What is an anterior placenta, and does it carry any complications or concerns towards your pregnancy? I'm Dr. Monica. I'm a board-certified OB-GYN and mom of 3, and in this video, we're going to talk a little bit about an anterior placenta, what exactly it is, and if it carries any possible complications or concerns for your pregnancy. The term anterior placenta is used to describe the location of the placenta in a pregnancy. This is usually diagnosed when you go for your 20-week anatomy ultrasound. This is when all the parts of the babies are looked at, as well as the placenta, to evaluate how it looks in its position. Now, the term anterior refers to the position, so where it is attached to the uterus. In today's hand-drawn diagram, as you can see in this diagram, anterior means towards the front. So if this is a diagram of a mom, this is the back, this is the front, here's baby in the uterus, the placenta is attached towards the front of the uterus. The other locations it could be are fundal, which means it's up here at the top of the uterus. Top of the uterus is referred to as the fundus, or posterior, which means this is attached towards the backside of the uterus. This term is just talking about where it's located in the uterus and where it is attached. Now, I will have a lot of patients be concerned about having an anterior placenta because they've heard that there can be complications from it. And the long story short of whether an anterior placenta is a problem or can cause complications is no. The main thing that patients will see when they have an anterior placenta is that they sometimes are not able to feel fetal movement as strongly or as early as patients who have fundal or posterior placentas. Now, as you can imagine, when you perceive fetal movement, the abdominal wall is what is noticing that sensation. So if baby's kicking away in here and there's this extra little layer of padding from the placenta, there's more tissue for those movements to kick through to be noticed by the abdominal wall in the skin. So due to that, our patients with anterior placentas may find that the movement of the baby is not perceived as strongly or as early as it would be otherwise, or they may notice that compared to other pregnancies where they did not have an anterior placenta, they're not feeling as much movement. Now, movement's very important in pregnancy. Movement helps us determine fetal well-being, and we can start doing things like kick counts. But most of the time, even if someone has an anterior placenta, by the time they get to 28 weeks, which is when we expect that more consistent fetal movement, the baby is big enough that even with that position of the placenta, you can still perceive the movements. Now, what about all those things you've seen on the internet about possible problems with the anterior placenta? Well, I've run through a bunch of research studies on PubMed, and I have seen a lot of confounding and conflicting results from studies showing that anterior placenta was related to different types of poor outcomes. Some of the studies just seemed almost silly because they had posterior placenta associated with all these lists of possible poor outcomes, everything from fetal growth restriction and diabetes to fetal death, and then the anterior placenta with this whole long list of complications. Same type of things. And then one study would find one for the posterior, one study would find the same thing for the anterior. They would contradict each other. Overall, there has not been any reproducible, solid evidence showing that the placental position causes any type of risk to the pregnancy or poor outcomes. Now, with that being said, one situation that does require a bit of closer attention with an anterior placenta is someone who has a prior C-section. So if someone has had prior C-sections, they have an anterior placenta and they have what's called a placenta previa, meaning that the placenta is also low, that does put them at an increased risk for having a placenta accreta spectrum disorder. So what does that mean? That means if someone has had a C-section, so they have a scar, a healed scar in this lower part of the uterus, their placenta is anterior and their placenta is low, so growing into the area of the uterus where the scar is, then they are at a higher risk of having either placenta accreta when the placenta grows into the uterus, placenta percreta when it gets even deeper into the uterus and go into other structures. That is one situation where an anterior placenta, especially if it's a previa or a low-lying placenta, can put you at increased risk for some complications. But for the average person who has not had a prior C-section, who does not have a low-lying placenta and just has anterior placenta, there's no other proven poor outcomes associated with that anterior placenta. So that's more of a rundown about the anterior placenta. Long story short, should not cause any additional complications, but can cause some changes in your perception of fetal movement. If you found this information helpful, please drop a like to help other people find it as well. And if you'd like more information about pregnancy, women's health, and breastfeeding information, go ahead and check out my channel. See you next time.